The Ebola virus disease, one of the deadliest in the world, a highly infectious disease that can kill up to 90% of the people who become infected, and there is no cure. Ebola was first discovered in 1976 in what is now the Democratic Republic of the Congo, near the Ebola River. Experts say that the virus entered the human population when infected bushmeat such as fruit bats and monkeys were captured, prepared, and eaten. Since then, outbreaks have occurred throughout Africa, infecting thousands. In the absence of effective treatment and a human vaccine, raising awareness of the risk factors for Ebola infection and the protective measures individuals can take is the only way to reduce human infection and death. So, what is Ebola virus disease? Formerly known as Ebola hemorrhagic fever, it is a severely acute viral illness, often characterized by the sudden onset of fever, intense weakness, muscle pain, headache, and sore throat. This is followed by vomiting, diarrhea, rash, impaired kidney and liver function, and in some cases, both internal and external bleeding. Ebola is highly contagious and can be easily transmitted from animals to humans through contaminated uncooked bushmeat such as chimpanzees, gorillas, fruit bats, monkeys, forest antelope, and porcupines. Ebola is not an airborne disease. Ebola virus spreads through human-to-human transmission from direct contact through broken skin or mucous membranes with the blood, secretions, organs, or other bodily fluids of infected people. Infections can occur through indirect contact with environments contaminated with such fluids. Direct contact with dead bodies, such as at funerals, is one of the main ways the disease is transmitted. In the last hours before death, the virus becomes extremely virulent, and therefore the risk of human transmission from dead body is much higher. Men who have recovered from the disease can still transmit the virus through their semen for up to 7 weeks after recovery from illness. If you or someone you know is showing signs of the Ebola virus, find a medical expert or facility immediately. Remember, this virus is extremely dangerous and there is no known cure. So following this simple rule could save your life. How do you protect you and others from the Ebola virus? First of all, wash your hands frequently with soap and water. If this is not available, use a hand sanitizer. Do not eat with your hands or touch your eyes, nose, or mouth with dirty hands. Keep your living and working environment clean. The Ebola virus cannot survive disinfectants. Use protective gear if you must care or go near someone you suspect has Ebola. And remember, dead bodies still transmit the virus, so always wear protective gear when near them or avoid them altogether. Do not touch dead bushmeat. Remember, this is where the Ebola virus was originally transmitted to humans. Restrict yourself to other types of meat and the food that you've prepared yourself. And finally, do not wait. If you or someone you know is showing signs of being infected, Do not avoid medical help. Contact the nearest healthcare professionals immediately. Failing to do so may result in your death or the death of those around you. Rumors and superstitions can kill. Understanding the differences between scientific fact and make-believe stories can be the difference between life and death. True or false? Salt and water will cure you of Ebola. False. Salt and water do not protect you against viruses. Otherwise, it would have been used to cure many diseases. True or false? Eating bitter cola will protect you from Ebola. False. Not a single person has been protected or cured by eating bitter cola. True or false? Once a patient recovers from Ebola, they are immune to the strain of the virus they contracted. This is true. True or false? An Ebola outbreak is officially considered at an end once 42 days have elapsed without any confirmed cases. This is also true. True or false? Some health workers and volunteers are purposely infecting people with Ebola to kill them. Absolutely false. Healthcare workers are putting their own lives in danger by exposing themselves to infected men, women, and children with the hope of saving lives. Healthcare workers have frequently been infected while treating patients with suspected or confirmed Ebola. Proof that no one is immune to the danger of this disease. The Ebola virus is a serious threat to all of us, young and old. Be aware and share what you learn from health officials about the disease. A simple precautionary step may be the one thing that keeps you from being infected, saving your life and the lives of neighbors, friends, and family around you.